This podcast and content posted by Dr. Judith Joseph is presented solely for general informational, educational, and entertainment purposes. The use of information on this podcast or materials linked from this podcast or website is at the user's own risk. It is not intended as a substitute for the advice of a physician, professional coach, psychotherapist, or other qualified professional diagnoses or treatment. Users should not disregard or delay in obtaining medical advice for any medical or mental health condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Have you ever had hives when you were anxious or started itching when you were overwhelmed? Dr. Brian Kim is known worldwide as the Itch Doctor. He has his own award-winning itch lab and even holds patents in the area. Did you know that men tend to have a lot of itching when they're guilt, whereas women have itching related to hormonal fluctuations? Men's mental health is often manifested as physical symptoms. So a guy will go to the doctor and be like, can you help me with this itch or with this body ailment? Rather than saying, you know what, I'm really anxious. So it's so important to know how men and women's health may manifest differently. We talk about different ways that you can address the itching related to guilt and trauma. What's one of the things that you've seen as the itch doctor that is a recent phenomenon based on social media and TikTok?
One of the things that I've seen for a long time that's getting a lot more attention now is a condition called red syndrome.
Wait, red what?
Red syndrome.
Okay, all right. I don't think I've heard of that one.
The root cause of it is some kind of guilt.
Interesting.
And as soon as I tell them that, it just clicks.
This episode of The Vault continues my skin, hair, and mental health series with the Itch Doctor and a special emphasis on men's health. You will not want to miss it. I'm so excited to have the Itch Doctor in The Vault.
Thank you for having me.
Well, you know, I have a lot of patients who, let's face it, they scratch a lot, they itch. Yeah. And we know that mental health is tied to skin health. And I started a series a year ago speaking with different dermatologists. Some were cosmetics, some were general, but I've never had an itch specialist. So I'm excited to get into this conversation.
Yeah, I'm excited to talk about it. It's all I think about.
How did you even go into that area?
Yeah, well, you know, I was initially trying to just figure out what causes eczema. A lot of people in your audience probably have eczema, or their kids do. And to solve that riddle, we had to figure out what causes inflammation. So what causes that red rash? And then I realized one day, we don't really know what causes the itch. It's the number one symptom in dermatology, right? So when we walk in, the first thing they say is, I'm itchy, I can't sleep. And we were essentially ignoring like what causes that. And that's where our science was really headed. And, you know, solved a couple riddles there. And that's where, and then we realized it's just a huge, huge area.
Wait, so the number one symptom is itch? I thought it was like pimples or acne.
No.
Okay.
And also, you know, if you think about medicine, right, it's really about the patient experience. Of course, we worry about things that might kill us. But aside from that, most of it is, I'm wheezing. I feel like I can't breathe if you have asthma. If you have inflammatory bowel disease, you're not talking about, oh, I have all these white blood cells that are infiltrating my colon more today. You're saying, I have pain, I have bloating, I have discomfort, I'm having diarrhea. You know, it's really all about the symptoms. And yeah, it's hands down the number one symptom in dermatology. That's
true. So what causes itch? I know you mentioned inflammation, you mentioned some of the conditions, but like, what's the science of itch? Because you're a researcher as well. You're not just you're not just a professional, you're not just a doctor, a physician, but you're also a researcher. So what causes itch?
Yeah, I mean, that was what we set out to ask. Okay. We knew already for a long time that histamine causes itch, which is a small, tiny little molecule that is produced by your body. But then we didn't know much more than that. And it turns out lots of things cause itch. And I initially thought that things outside your body causes itch, and they do. So allergens, irritants, and things like that. But then I start to realize as we study this, what you're really understanding when you study itch is how your body actually senses inflammation, things within your body. And then that's actually snowballed into actually us appreciating that we're sensing many things throughout our body. So it's not just itch. So our research has gone well beyond itch, but I'm a dermatologist. So the biggest problem people walk into the clinic with is itching and chronic itching of all different kinds. So many things cause itch. We're still discovering many, many more molecules. And why is that important? Well, those molecules then become targets for therapy, which also I have a big hand in developing.
And you can itch like all over your body. You can have an itch in your nose, you can have an itch in your throat, you can have itchiness in your eyes, your scalp. There are just so many different places to experience this. What I see in psychiatry is a lot of anxiety tied to itching. So how, like, help our listeners to explain how that happens.
Yeah. So there's a number of ways to think about it. So I think the first thing is to kind of define what itch is. And it really is a sensation, an uncomfortable sensation on the skin or the outer surface of your body. You mentioned the eyes or even inside your nose, but it's really kind of the outside, right? We don't itch from our liver. That's
true.
We don't itch from our kidneys, but anything that's outward facing, you have these nerves that are very itch ticklish in a way. Those things can itch. And what it is some sensation, uncomfortable sensation that triggers a desire. The desire comes from your brain to scratch. But it doesn't have to always be from the brain. It could also be a reflex. So by reflex, I mean, it could just trigger this circuit that doesn't even have to go to your brain, where you just scratch without even knowing it. And a lot of itchy people will do that. They'll scratch in their sleep.
My daughter the other day, she was like, Mom, I have an itch. So I scratched it for her, and then she came back. She was like, do it again. And I was like, if I keep doing it, you're just going to want to, you're just going to want more of it, right? Because it feels good. It does. Right? Explain that.
Yeah, it does feel good. We all know that when we get a mosquito bite and we scratch it, you want to keep scratching it even more. And that's not even chronic. That's just kind of a few days to like a week. It does feel good. But I think that's partly, there are things that are related to itch that we evolved to experience itch for a reason. And the reason was that if there's some kind of irritating substance, it's to actually mechanically remove it before it really invades your body, like a parasite. That's really why we evolved to experience itching. And so the idea is that if you experience itch and you get a little addicted to it in the short term, that's probably a good thing, because you're ensuring that whatever that thing is actually getting expelled from your body. Where it turns into disease is when that short-term thing starts to become a long-term addiction, and you feel very addicted to the feeling. And that in certain conditions in particular happens. So it's a weird double-edged sword where it drives you crazy, but it also feels good to scratch. But the itch is what drives you crazy. The scratching is what makes you feel good. It's not the itching that makes you feel good. That's very clear. So that's an uncomfortable sensation, but the scratching sometimes can make you feel quite good. So it's this weird yin and yang. And the reason why itch is so maddening is that it's actually different from chronic pain. So there's a study that actually I posted to Twitter just a week ago, I think, that where they did this study out of the University of Washington where fish actually itch.
In water?
Even in water.
How could they tell that?
And so I'll explain. They actually gave a substance to the fish that makes them actually itchy. And what they'll do is they'll actually rub up against the wall repeatedly. And they look like they're kind of out of their mind a bit. And then they gave something that causes pain to the other fish, the zebrafish, and it just sits there. It doesn't want to move. And the idea is that actually if you have pain, even acute pain, you don't really want to move. Right? You want to actually sit still, let that bone heal, metabolically preserve your energy, and you want to heal. Again, it goes back to itch is trying to kick out a worm from your skin. So you want to keep moving. You want to get a little addicted to that. You want to keep scratching it. But that's also maddening, because why? You're not able to sit still. And chronic pain, you can actually tune out. It's terrible, but you can actually tune out. And we've all experienced chronic pain. Even if you have dental pain or something, what actually happens? A lot of people just sleep for like 10 hours. And you're like, oh my gosh, he must be in a lot of pain. He's been in bed all night, won't get up. Itching's not like that. Itching is where you're not sleeping. And you start to really lose your mind. And it's actually, the patients who experience that tell me it's actually much worse than when a lot of people have chronic pain too. So they take chronic pain over chronic itching any day.
It makes sense, because when I think of pain, I think of depression. When I think of itch, I think of anxiety. And at least, I mean, not to say that one is better than the other, but at least when you're in pain, sometimes you do get some respite from it because you pass out, you sleep. But the itching, there's like no relief. And it reminded me of a patient a couple of years ago that I saw during training in my residency training, who is an inpatient, and they got so they just couldn't get rid of this itch that was actually psychological because they had a psychotic condition. They had schizophrenia. But there was a perceived delusion that there was a parasite, and they kept clawing at their skin. And it made us start to wonder, okay, should we actually treat the itch? Because like you said, that mind-body connection is so strong that even if it's perceived delusion, the scratching just set off some cycle in this patient. And so like, what are some of would you say like the 3 type of buckets we should be concerned about? Like, what are 3 things people should know about itch?
Yeah. Well, I think the 3 things that you want to know about if you're suffering from itching is, can you identify a cause that's obvious? Most people can do that if it is obvious, right? But some are not so obvious. So the 3 ways I think about it is there something really wrong with you? Do you have liver failure or your kidneys failing or something like that? There are clues to that. If your eyes turn yellow, that's an ominous sign for your liver. If it's suddenly you have sudden onset of widespread itch you've never had before, that's usually concerning. It could even mean that you have cancer, like lymphoma.
Really? Wow.
It can.
Okay.
I've caught a number of them. Now, this is not to alarm people, but it does alarm people. But so you want to make sure that something's not completely awry in your body and that you don't have a serious disease. And that's why you want to go see a doctor, to rule that out. For me, it's easy to rule those things out. And then the second thing is there's something obvious that you missed. And one that people miss often is an infestation.
Ugh.
Yeah, I know.
Sorry about that. I have a thing against bugs.
Yeah. And
continue.
Yeah.
Sorry,
So scabies and things like that. So that gets missed, believe it or not, all the time. I myself have missed it. I've also caught it from patients. So you can actually miss that. And then the kind of the third thing is it something not serious, but there's some other cause of the itching, and that's where it becomes a little bit more of a mystery, and that's where I live. So I kind of rule out the serious and obvious or the not serious and obvious, and then what could actually be causing it? Do you have eczema? Do you have something else? A lot of the patients that I see are elderly individuals who've developed itching. There's no known cause, but we figured out ways to treat them.
So it sounds like if it's not so serious, it could be something like anxiety, which is, can be serious for some, but it's not life-threatening. Like if someone has hives because they're anxious, that's not considered an emergency, a medical emergency. But if you're turning yellow and your eyes are turning yellow, or you have this sudden rapid onset itching, it could be serious, like cancer or liver failure or jaundice, right?
Right. Yeah. You want to make sure that, or if you're itching and you have weight loss and you have other weird symptoms that are pretty dramatic, you want to get checked out right away.
Yeah. I mean, that makes sense. What are some like typical things people have around the house or can get easily from a pharmacy that helps with that itching related to anxiety?
Yeah. Well, none of the treatments are that great, but there are some do's and don'ts too. So one thing that's great is actually there are certain chemicals that are good for itching that are topical, like menthol and pramoxine. So these are topical medications that you can find pretty easily at the pharmacy. They're usually in a jar. Of course, if you actually have like dry skin, a lot of people have dry skin, the barrier's breaking down, then moisturizers are really good, but not the kind that you pump out.
Okay.
Necessarily things that are in a jar. And why are things in a jar? Usually it means that they're thick. They're usually on the bottom shelf in the pharmacy. And those are actually usually better than things that are you're kind of pumping out.
I did not know that.
Yeah. Well, it's the opposite. The reason why, at the end of the day, the reason why there's so many moisturizers in dermatology is just a way to make them much more appealing and thin and that they feel pleasant on your skin. But that's not always good for people who are itching. So that's more just kind of to be appealing. But the problem with that is sometimes those kinds of moisturizers, ironically, actually they put a lot of chemicals in there to give them those properties. You can also then develop irritation and reactions to those kinds of substances as well.
So how about Vaseline? Is that a good one?
Vaseline's good. Okay. Yeah, it's generally good, but itch is complex. So there's some people that if they have itch that's aggravated by kind of things being closed off and occluded or sweat sets it off, Vaseline does have that kind of thick, where you feel a little bit trapped feeling. So it really depends on what kind of itch you have. But one thing I do not recommend at all is topical Benadryl.
Really?
Yeah. Oral Benadryl you can take. It does have some anti-itch. It puts people to sleep a bit, but the topical one can actually cause allergy.
I did not know that. So it's an antihistamine?
Is that what it is? Yeah, it's an antihistamine.
But if it's put on the skin and not taken by mouth, it could actually
cause an allergic skin reaction.
Okay.
Yeah, and worsen things. And the other thing that I've seen people do, it's weird. I mean, it's probably kind of intuitive. People go, well, why don't I use Neosporin or a topical antibiotic I can get off the shelf? Those often can actually cause allergy too. So I've seen a lot of people come in and they do a lot to themselves with over-the-counter, and they don't realize they actually gave themselves even worse itching as a result of that.
Are there any natural type of remedies for itch that people who, let's say, don't have access to a drugstore or pharmacy, or they want to stick with more, I guess, perceived natural things? Yeah. Are there any things like that they can use?
I mean, I think, things that are kind of naturally kind of oily is good, as long as doesn't have a bunch of weird stuff in it, right? And so that's my key, is that if it has a million ingredients, you want to be a little bit careful. But yeah, a lot of people use a lot of different kind of natural oils and things like that. It does help the skin barrier. So yeah, it's pretty harmless if you do that.
Yeah, in Caribbean cultures, coconut oil is
everywhere. Yeah. So yeah, lots of natural oils people use.
So what are the top 3 mental health conditions that you see tied to itch?
Yeah, it's interesting. There's actually there's kind of 3 kinds, of mental health itch. Okay, and then we can dive deeper into it. But out of the gate, you mentioned one of them, which is where you actually have delusions of parasitosis, and I've seen this a lot. That's where people actually believe. And what amazes me about this condition is that these are high-functioning people. I've had lawyers, accountants, doctors. They come in with a very fixed delusion that parasites are actually coming out of their skin. And I've seen it evolve where they initially realize that they're starting to develop a little bit of delusion and kind of slip into it. That's obviously extreme, but it's incredibly distressing. Yes. And the hardest part about that actually is that they're actually not itching. Because remember I said itching is actually an uncomfortable sensation that triggers a desire to scratch. This is not really that kind. It's actually your brain is actually perceiving not a sensation. It's a different sensation. It's actually perceiving literally something, an object that's burrowing through your skin. Very hard to treat though. There is a drug that works really well for it. You'll know because you're a psychiatrist, called Pimozide. But you cannot get these patients on Pimozide ever. I mean, it's almost impossible because they have such a fixed delusion that any suggestion that this is actually a psychiatric disease is immediately you're fired as a physician. Yeah, so it's very challenging. I feel incredible empathy and sympathy for them because it's incredibly distressing.
I wonder if that patient the case that I talked about, because you said it was a different type of itch, but I wonder if that person itching and irritating their skin caused the secondary itch. So they had 2 processes going on.
Absolutely. So I do that. And I can kind of come to that point in a little bit too. So in that case, yes, absolutely. And that actually brings me to the second kind of itch that's related to mental health a little bit, which is actually now there's a pejorative term that we don't really use anymore. In the old days, it was called neurotic excoriations, but now we refer to it as excoriation disorder.
Okay.
And these individuals are really hard to distinguish because they'll have these little nodules all over their arms. For whatever reason, the demographic tends to be kind of middle-aged women, and they'll have it on their arms and they'll pick. And you'll say, does it itch? And they'll say, yeah, I guess so. But really, it's just like, I just feel like picking. So they're not really describing that like sensory, like, gosh, it's so itchy. They're just, I feel like picking. That's more of now it's not delusional. It's more of a compulsive disorder. So I think it makes them feel good to pick at something. And it's more kind of like I think of Tourette syndrome or something like that.
OCD.
Yeah, like you have a cough and it feels good to cough, even though there's nothing in your throat. Right. It's more like that. That's also not quite an itch because it's more kind of this compulsion that's driving it. It's more centrally from the brain driven. And then you get to itch, true itch, in the truest sense. And it's important because how you would treat these three things are slightly different. As you know, delusion's probably treated differently than compulsion. And then there's itch, which is not really a compulsion where it's actually you feel a sensation, you start scratching. To your point, all of these things, you can cause more damage to the skin. And then now you're introducing a component of itch on top of a delusion or a compulsion, but also causing more itch.
Right.
And that's what you're talking about with your daughter.
So you have two itches going on.
Yeah. So that's what we mean by the itch scratch cycle. So, and then there's like there's like a whole array of things. And how does that itch start? Does it start with inflammation? Does it start with your nerves firing? Is it because your liver fails and now you have bile acids everywhere triggering itching? And that's kind of the world of itch.
Okay. Wow. So fascinating. So you're a researcher. What are some of the recent breakthroughs or the things that you've learned in this itch journey?
We've learned a lot. Okay. We've learned that itch is not pain. So we're talking about itch as 2024. 10 years ago, we would probably not be talking here. It really wasn't a big thing because there was a misunderstanding that itch was just a mild form of pain. And so, there are pain centers all over. There weren't itch centers, right? So in medicine, we've really overlooked it. We haven't taken it quite seriously. It's actually not. What caused the pathways that cause itch are very specific. Okay. So it's not. So the reason why we actually have to prove that a lot of these different pathways that cause itch are truly itch by saying they're not pain. We have to prove that we're not pain.
Hence the fish study.
Yeah, and other studies like that. And so that was the big breakthrough. So that's kind of the first big breakthrough. And then what we found is that in your nervous system, all these nerves throughout your body, the nerves actually that cause itch are really distinct. And that's related to what I just said. And they're actually easily identified. And now we know that there are specific molecules we can block to alleviate itch. And that's where our work really kind of started in, is finding new ways to treat itch.
Wow. And have you learned anything in terms of menopause and itching? Because you mentioned midlife is when a lot of women come in with this like kind of picking sensation. I know it's not the same as itch, but have you seen anything recently in that?
Yeah, we're studying a lot of women's health in general. So we're actually trying to understand why is the nervous system different in women versus men. So I'm going to kind of depart from itch a little bit, but there are conditions. So for instance, we've tried to understand, can you have itch in other organs? So you itch in the skin, but are there kind of analogs of itch in other organs, right? Yeah. And we think the bladder is one beautiful organ to actually study the itch equivalent, right? And there's a condition called interstitial cystitis. Also affects women. Like 95% are women. This is essentially where you wake up in the middle of the night. Imagine thinking that you have a UTI for months. You get treated with antibiotics, it doesn't go away. Burning, stinging. Every time your bladder distends because it fills, you have pain, you have to wake up, empty your bladder. Wake up again 3 hours later, empty your bladder. Miserable. So that's mechanical. It's like scratching. Right. You're actually mechanically emptying to feel relief. Whereas in the skin, you're scratching. Why so many women? Well, the nervous system is different in women. Actually, what we're starting to understand is that the bladder is co-housed with the colon and the uterus. And these nerves actually are kind of, the wires cross there. And so we think that there are certainly menopause and hormonal axes, but we think there are actually actual how the nervous system is just wired from birth affects why women get bladder irritation and men generally don't. Men and women both have bladders, but women, traditionally we thought, it's because women get UTIs, but I don't think that's the whole story. But I'll bring it back to itch a little bit more. The other thing that women suffer from a lot is this kind of traditional concept, what people call central sensitization.
Okay.
So you start off with, say, pain in the bladder. Let's start there. And then over time, you start to develop pain in other parts of the body. And there's something very unique about where women get a lot more fibromyalgia, where they have pain in certain pressure points. And we think that this kind of how the nervous system is wired in women from birth may actually be setting them up for this kind of hypersensitivity. And it's really widespread. Migraine, irritable bowel syndrome, interstitial cystitis, I mentioned, uterine pain, pelvic pain, endometriosis, fibromyalgia, where it starts to like really spread all over the body. This is very much kind of in the domain of women's health. And so there might be patterns like that for why there are certain itch conditions that affect women more than men.
That's so interesting. And that's why we need more research and development for women's health.
Definitely. It's a big, big area. It's been really odd because we just kind of ignored, these are like obvious differences. Like even, we're thinking, oh gosh, there's like a whole nother organ here that could be impacting the bladder.
It's
right?
really unfortunate. Hopefully that changes very soon. What's one of the things that you've seen as the itch doctor that is a recent phenomenon based on social media and TikTok?
Yeah, I mean, one of the things that I've seen for a long time that's getting a lot more attention now is a condition called red scrotum syndrome.
Wait, red what?
Red scrotum syndrome.
Okay, all right.
Or
I don't think I've heard of that one. All right.
Yeah, it's absolutely fascinating. And these patients come to me because I think they understand that I study why certain sensations like itch and other things kind of trigger, your brain. And they'll come in with a bag full of jock itch creams, anti-inflammatory, hydrocortisone, prescription medications, all this stuff. And what essentially they've done is they've actually irritated their scrotum with all these things, and to the point that it's just become really red and irritated.
Wait, so is that jock itch?
It's not jock itch.
Okay.
They think it's jock itch, or they think it's an STD, or they think they have some other condition. They'll come in with multiple tests for STDs. And what really they've done is they've given themselves a form of rosacea on the scrotum, where it's the blood vessels just dilated. It's a really, really thin skin, but the sensation down there is just driving them crazy. The root cause of it is some kind of sexual guilt.
Interesting.
So the kinds of patients I've seen is, I'll give certain examples, hyper-religious family, right? Guy's told that he shouldn't masturbate, something like that. Affairs, right? Someone has an affair.
That has a lot of guilt.
Yeah. And they're just all different, even theoretical guilt. Nothing even really happened, but they just feel guilty about it.
So it's the mind-body connection that they've done something that they think is wrong sexually, and that leads them to experience itch?
It can be itching, burning, stinging in that area, and they just get hyper-focused. And then it kind of manifests as this real rash.
So what's the treatment for that? Is it therapy? Is it antidepressants?
So one of the things that these patients have to do is they have to stop all that stuff that's in the bag. Okay. Those are irritants. There are some limited treatments. One of my favorite actually is a medicine called carvedilol. It's actually a blood pressure medication, but what it does is it calms down the blood vessels. And that's one thing. And I tell them really try not to do anything, but what they really have to do is, first of all, understand what the cause is, the sexual guilt. 100% of the time, they believe me. And it clicks. And then once they make that connection, then it's to resolve that guilt.
That's so fascinating.
Whatever that is.
You're a dermatologist, not even a therapist. But if they tell you, if they confess to you, they feel better.
They feel better. They start getting better. And then they have to resolve it in their own life, whatever that is, if it's an affair or something like that. And once they do that, it starts to unwind and they start to get better. But what I think happens is that they don't want to admit that there's some deep-seated root cause. So it's great to blame something. It's a kind of a sexual associated organ. So it's kind of a scapegoat. And they'll often have seen 12, 15, 20 doctors before they come see me. And as soon as I tell them that, it just clicks. It doesn't mean they're necessarily going to fix it overnight, as you know. But they have to now reckon with that. And then that's really the cure.
Have you seen something like equivalent in women?
Yeah, there's a similar condition in women. It's actually called burning tongue.
Wow.
And for some reason, it's the tongue. And obviously, you can't do as much to the tongue, but they'll get biopsies. It's this burning sensation. The tongue might even be red, and they get irritated. So what it tells you is that the mind is really powerful, and it can actually cause things to happen throughout your body.
The mind body is real.
Yep. Very, very real.
I always ask my experts, what was a time in their lives when on the outside, everything looked great, and really on the inside, they were struggling, and how did they get through that?
Me personally? Mm-hmm. Oh, wow. I think that's a lot of time.
Well, you're a dermatologist, so it always looks good, right?
Yeah, gosh, that's interesting. Yeah, I think, that we all go through our, you know this all too well, as a psychiatrist. I think we all go through internal struggles, right? And I think I'd say that there are many periods in my life where externally things look great. I think even now, and I think I have internal struggles now that are much greater than anyone would perceive on the outside. But what those are, it's I think the things that we struggle with are even, what's our kind of our perception of life, right? The thing that I would say I struggle with most right now is am I actually doing things that are meaningful or not? Or am I just wasting my time? And I think time becomes so important as you get older, and we're all trying to fight time in some ways. So I think there's a lot of struggle we all go through, and I this better than me. I think we can't judge. I worry a little bit, when I look at things like social media and people immediately, someone does something wrong, like even a child, and they get completely attacked. And I think, gosh, maybe something's going on with their parent. The child might be undergoing abuse or something. And I think we don't really think about the internal struggles. And I learned that from seeing patients with itch, right? Because the problem with medicine, and it's same with mental health, is we say, oh, if there's a nodule on an x-ray, there's a tumor on a biopsy, or even a lab abnormality, okay, that's great. Yeah. Let's go after that, right? But if it's subjective, and you say, gosh, I'm depressed or anxious, or I'm itching and I can't sleep, we kind of go, oh, is that really serious? Right? And I think even for itching, a lot of times the way we dismiss itch, and this, is we say, oh, maybe they're just crazy.
Crazy, yep.
All right. But in my mind, okay, even if they are crazy, shouldn't we treat that? Right? So it's not, that shouldn't be an excuse to say I'm out, right? So yeah, I've seen how people suffer silently, and I still do. Continuously.
And how do you cope with that? What helps you get through those times?
I cope with that by, I think some of it might be in my own way, right? I think that's why I do science, right? And it's also helped. The irony is actually the way that I cope with my patient suffering sometimes was understanding how I dealt with my own suffering. So there was actually a period in my life, I actually developed this very severe vertigo. So I had spinning for like 2 years. It was really bad. Wow. And I actually thought thoughts ran through my mind like, oh gosh, I'm going to be disabled and all this. And truthfully, the physicians didn't really take me that seriously. And I'm a physician and a scientist, and I'm, doing all this stuff. And I realized that during that period. And so maybe that's a concrete example of a suffering. It was completely internal. I looked fine.
Invisible illness.
It was an invisible illness. And it really made me understand itch much better. So when I see patients go through it, I think there's a level of kind of putting myself in their place. And it helps me too, because you know what? That's not the last time I'm going to struggle with something, right? So to understand how they go through it, and I learn how they go through it and their attitude about it and such.
So you cope with compassion.
I think so, but that's not, it sounds kind of corny, and it sounds like...
It doesn't sound corny at all.
But it's selfish in a way, right? The compassion is selfish because I'm trying to understand how they cope so that I can also cope. And it's this weird thing. And it's because I went through it. But I think before I went through those kinds of things, I viewed it as their problem. Mm-hmm. I didn't view it as my problem, right? It was their problem and I'm going to fix it, right? But now I view it as that's a problem I could have.
Well, it helps you to listen, like as a therapist, if I'm going through something personal and it's painful, I find that weeks later, I'm a better listener.
Yeah.
And, it really creates a sense of community if you don't separate yourself at times and you're like, that could happen to me.
Yeah.
Right. That could be me sitting in that chair. Thank you so much for coming onto the podcast today. Where can we follow you, find you, and keep up with all of your amazing research?
Oh, well, thank you so much for having me. Yeah, I'm Dr. Brian Kim on TikTok, Instagram, and YouTube, and then on Twitter, Itch Doctor. But yeah, we do science, we do clinical, we talk about these different itch conditions and lots of other conditions. So thanks for having me.
It was a pleasure.